In this video, we are going to see some quick notes on anti-epileptic drugs. This is part 2 of these drugs. You can find part 1 in the description box. So let's get started. So first drug is Felbamate. The main points that you must remember about this drug is that it has a broad spectrum of anticonvulsant action. There are multiple proposed mechanisms for this drug, like it blocks the voltage-dependent sodium channels, it competes with the glycine coagonist binding site on the NMDA N-methyl D-aspartate glutamate receptor, blocking of calcium channels, and potentiation of GABA action. This drug is reserved for the use in refractory epilepsies because of the risk of hepatic failure and aplastic anemia. So the next drug is Lacosamide. This drug in vitro affects voltage-gated sodium channels, which results in the stabilization of hyperexcitable neuronal membranes and inhibition of repetitive neuronal firing. This drug binds to CRMP2, which is collapsin response mediator protein 2. This is a phosphoprotein involved in neuronal differentiation and control of axonal outgrowth. This drug is approved for adjunctive treatment of focal seizures and is available in injectable formulation. Vigabatrin. Vigabatrin acts as an irreversible inhibitor of gamma-amine butyric acid transaminase GABA-T. This enzyme is responsible for the metabolism of GABA. This drug is used for infantile spasms and refractory complex partial seizures. However, this drug is associated with visual field loss ranging from mild to severe in 30% or more of the patients. Zonisamide. Zonisamide is a sulfonamide derivative. This has a broad spectrum of action. Zonisamide has multiple effects, including blockade of voltage-gated sodium channels and T-type calcium currents. It has limited amount of carbonic anhydrase activity. Zonisamide is approved for the use in patients with focal epilepsy. This drug may cause kidney stones as well as a side effect, in addition to its typical CNS side effects. This drug is contraindicated in patients with sulfonamide and carbonic anhydrase inhibitor hypersensitivity. Valproic acid and Divalproex. Mechanism of action include the blockade of sodium channels, blockade of GABA transaminase, and action at the T-type calcium channels. This drug is effective in the treatment of focal and primary generalized seizures. Valproic acid is available as a free acid. However, divalproic sodium is a combination of sodium valproate and valproic acid, which is converted to valproate when it reaches the GIT. It was developed to improve the gastrointestinal tolerance of valproic acid. Rare hepatotoxicity by this drug may cause a rise in the liver enzymes, which should be monitored frequently. Teratogenicity is also of great concern. Topiramate. Topiramate has again multiple mechanisms of actions. It blocks the voltage-dependent sodium channels, reduces high-voltage calcium currents. L-type, it is a carbonic anhydrase inhibitor, and it also may act at glutamate NMDA sites. This drug is used in partial and primary generalized epilepsy. Tiagabine. Tiagabine blocks GABA uptake into the presynaptic neurons, permitting more GABA to be available for receptor binding, and therefore it enhances inhibitory activity. Tiagabine is effective as an adjunctive treatment in partial onset seizures. So that's it. Thanks for watching. If you like the video, don't forget to like, share, and subscribe PharmCept. Thank you.